everyone. I am happy to welcome each and every one of you to today's MEND webinar, where we will be discussing how to predict patient attendance reliably and engage them automatically to see if they are really showing or not. My name is Brooke. I am a junior marketing coordinator here at MEND, and today I have the privilege of joining Matt McBride, CEO at MEND. Matt, how are you doing today?
Brooke, I'm doing amazing, and it's exciting to be on today and talking about some really cool, innovative stuff.
The agenda is packed with information today to increase productivity and access to care. Matt is going to take us through the process of predicting attendance and automated interventions with patients. Finally, we'll round out today's webinar with a Q&A session. Starting now, you can use the Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. All right, let's dive in. A meta-analysis published on Science Direct shows that the average no-show rate in the US is 23%. Matt, can you explain the no-show problem to our audience?
Yeah, I mean, and I think there are some other studies that have shown it to be even higher, during the pandemic or kind of at the point where we're at now, which if you really start to think about that, 23% is 1 in 4. So if 1 in 4 people that you're putting on the schedule are not going to attend, that's pretty significant. Or let's say you look at a 4-month period. That means a month's worth of business is lost, or 3 months a year potentially from people taking slots on a schedule that they're not actually going to attend. So definitely a problem in healthcare. And I think many of the folks listening today will be familiar with some of the reasons, but why do patients miss appointments? Some of the most common reasons could be some sort of financial barrier, employment or childcare conflicts in their schedule, just not able to make the time, any sort of transportation barriers or logistics. If you're in a busy metropolitan area where parking is not always easy to find, or maybe there's even an expense to parking, that could be an issue, to emotional challenges and even for forgetfulness. So again, probably some reasons we're all familiar with, but definitely a significant problem, and a more significant problem for appointments where a patient is attending in person.
When patients miss appointments, it affects both revenue and patient outcomes. Matt, can you explain the monetary impact and how our audience can access ROI for their own organization?
Yeah, so we have a tool. There is the web address for that. It's just men.com/ROI-calculator. And on that page, you can very easily answer 4 simple questions, right? The number of providers or clinicians, or the number of billable folks, the current no-show rate, average revenue per visit, and then what is the patient volume on a daily basis? How many patients per day are those providers seeing? And we'll provide an entire analysis. You'll have an idea of how many appointments per day you might be losing. What's the monetary value of that? What is the value if you were to reduce no-shows by 5%, by 10%, by 15%? So if you just want a very user-friendly, simple way to further define this problem for your organization and really understand the financial impact, we'll talk about the patient impact in a second here. But if you really want to understand that monetary impact, it's just an incredibly simple, intuitive tool, and it will instantly produce the results for you.
An impact of patient no-shows is that patients are not getting medical attention. A 2019 study of 1 million patients by Athena revealed shocking data about missed appointments. Matt, can you explain the findings of this study?
Yeah, so I mean, I think really interesting results, specifically pertaining to patient loyalty, right? So not only is somebody that no shows taking up a slot that probably could have been used by somebody else, those patients are also unlikely to come back. Their attrition rates are much higher. So 70% relative to a 19% attrition rate for folks who attend their appointments. And then the survey further showed that the patients that didn't show were really unlikely over an 18-month period to show again. So having that retention, having that loyalty, having that repeat customer or patient, if it's ever necessary, is important, because it can be expensive to acquire a new customer, or expensive to get that patient into your organization. So along with that, there are potential negative effects to outcomes, because they're missing screenings, they're not having a doctor to take a look at their medications, not checking in, not having vitals taken. So definitely significant impacts to the patient's health as well, relative to no-shows.
Mend is an enterprise patient engagement platform that offers easy patient intake and communications, custom in-office and virtual care workflows, and seamless telehealth optimized with AI. Matt, how do our different solutions work to help solve the problem of no-shows?
Yeah, I think a great way to think about patient engagement, or even measuring patient engagement, is reduction of no-shows. So just to kind of go around the wheel real quick here, patient self-scheduling is an example. We see a lower no-show rate when patients self-schedule their appointments. The no-show rate can be, it could be a 50% reduction there, because the person scheduled their own appointment. Telemedicine has really proven to produce single-digit no-show rates, and we see that across the board at Mend. All of our customers, all of our appointments in aggregate, if we look at the no-show rates across the board, it averages in the single digits. So telemedicine is another effective way to address the no-shows. Digital forms, we send those out before an appointment, and I like to think of that as the new appointment confirmation, because if somebody completes their forms, they're starting to engage in that appointment, they're starting to invest their time. The engagement doesn't just happen when they walk through the doors or when they join a virtual waiting room. The engagement is happening before the visit occurs, which is a great indicator of attendance. And so I really like to think of digital forms as the new appointment confirmation. If they complete their forms, they're going to attend. We're going to spend quite a bit of time talking about the attendance predictor today, and how that works and the ins and outs there. We also have appointment reminders, and we touched on that forgetfulness. We have appointment reminders, and those sort of tie into the attendance predictor. So we'll take everybody through both of those. And then finally, we are working on a new digital check-in process, and also automated patient payments before the visit. And those two things, like seeing engagement, checking in ahead of the appointment, making a payment, co-payment ahead of an appointment, all of these things are really going to tie into attendance, and is somebody likely to attend or not, based on the engagement and kind of getting them involved before that appointment ever occurs.
The US national average no-show rate is 23%. Specialties such as behavioral health average as high as 37%. Matt, how is Mend innovating to address this issue?
Yeah, so I think one of, or maybe even the most innovative product that we have, which is in beta with a number of existing customers, is we have an AI patient attendance predictor. So we have machine learning algorithms that can assign risk and help predict if somebody's going to attend. And then we have the patient engagement side of the equation, right? So are they opening appointment reminders? Are they doing forms? Are they making payments? Are they checking in? We can ask them, are you coming or not? And they can say, no, I'm not. Yes, I am coming. So it's sort of a combination of AI that can look for risk. And then we have the whole patient engagement piece, as Mend is a complete patient engagement platform across virtual and in-person appointment. We have the whole patient engagement piece to help further identify who is actually going to attend an appointment before it happens. So we're gonna dive into the details and kind of take everybody through every step in the process and exactly how everything works today.
Matt, thank you for the overview of Mend's patient attendance predictor. Can you explain in more detail the automated patient engagement that complements the AI?
Yeah, so when we get the information about an appointment, we receive the demographics and the appointment information, most likely through an integration. That allows us to make an initial prediction. And so, a month away from the appointment, we can make a pretty accurate prediction on whether or not somebody is going to attend. But that's really only the beginning of this, right? Because we're going to use that information, and we're not going to try to remove somebody from the schedule or do anything like that. All we're going to do is we're going to engage that person differently. We're going to send them content that's different in the text message that we send out to remind them of the appointment. We're going to send them content that is different in the email or the automated phone call that goes out. The content is going to be different, and the content is really going to be emphasizing that they confirm or tell us that they're not coming. So in just an extremely frictionless process, we can reach out, we can ask everybody automatically, are you coming or not? And as well as look at other data we have around engagement or ways that we might be connecting with this person before the appointment, whether it be forms or payments or anything like that. So it's really a combination of, yes, we're making a prediction, but that's just the start. Now we're gonna reach out proactively, fully automated, and ask the person simply, are you coming or not?
A common question we receive is, what data are we using to make accurate and actionable predictions? Matt, can you explain some of the factors we use?
Absolutely. And we can't put all of the secrets out there, but we definitely wanted to try to put some examples. There's probably about 40 to 50 different factors that we use. And it's really a combination of the demographic information that we receive, but just basic demographics, right? We're talking about, we're getting date of birth, we're getting email, we're getting phone number. So we're looking at things like, how can we contact them? Can we contact them at all? And then the appointment that we receive, right? So we could be looking at the day of the week or the time of the appointment, the type of appointment that it is, right? A new patient appointment type or a follow-up appointment type may have a lot higher no-show rate than other types of appointments. Also considering maybe specialties, and potentially, age. Have they logged in or kind of connected on our site at all? And then, of course, a past history, right? Is there a past history of no shows, a past history of late cancellations? Those are sort of all the type, some examples of some of the types of things that we'll look at and allow the AI to provide some guidance on who we need to reach out to differently and really get that confirmation, or allow them to cancel and get out of the way so somebody else can use that slot.
The use of AI, especially in healthcare, sparks questions around ethics. Matt, can you explain how MEND addresses this?
Yeah, so I think first and foremost, we try not to include any data in our algorithms that might be considered unethical. So we're not trying to look at income, what's your education level, what type of insurance you have, your housing status. We're not taking in any of that information whatsoever. The only pieces of information that we do look at is age, and there is some correlation that we find based on gender. But really that's sort of, the gender of the patient relative to the gender of the provider. And so from there, it's really just not trying to bring in any data or allow any data to be used that could, be discriminatory or be perceived as unethical. So that's sort of step one. Step two is there's some separation between the final prediction and all the factors that we use. So we take those factors and we try to predict certain outcomes. Those outcomes wouldn't be not, health outcomes, but what's the outcome of that appointment going to be? What's the likelihood of them attending? What's the likelihood of them no showing? What's the likelihood of them potentially canceling or late canceling? And so we have 6 different outcomes that we calculate. And then that goes through another AI machine learning process. So once we have a risk factor for all of those different outcomes, we're able to make a final prediction. And that prediction changes. It can change on a daily basis leading up to the appointment as we get new engagement data, or somebody confirms or somebody cancels. That's all new information that will adjust and be reflected in the final prediction. So we sort of take these factors, we predict some outcomes like attend or no show, and then we use that to make a final prediction that is then updated as we learn new information from any automated patient engagement that we're doing.
AI is only half of the solution when it comes to MEND's patient attendance predictor. Understanding who is likely to attend versus unlikely to attend is great. But Matt, please explain how we automate patient outreach as part of the MEND solution.
Yeah, so here's an example of how we might communicate a little bit differently. This isn't exact language that we use, but it just illustrates the point that we can have different content when there is a higher risk of non-attendance. And then we just could have a standard appointment reminder that goes out to somebody who's, low risk of attending an appointment. And then you can see on the right side for the high risk, we're really then also making it very easy to confirm and cancel. And we'll show this in a few slides, but asking the person to confirm and cancel, they would click a link, put in their date of birth, and then simply tell us if they're coming or not. So in a very frictionless experience, in something that they can do 24/7, 365 when it's convenient for them. We can do this via text. We can do this via email. We can do this by automated phone call. And this allows us to get that communication out and then really just have the person tell us if they're coming or not, making it really convenient for them to just say, yes, I'm coming, or no, I'm not, is another really important part of this. And doing it via text message is another extremely important part of this, because 90% of text messages are read within 3 minutes. Some participants on the call today probably received a text while being in the session, and they've maybe even already looked at it and replied to it. So text messages can be an incredibly effective way. And so it's really this combination of making the prediction and then reaching out to them automatically and having them tell us if they come or not.
That's exciting. Practice staff doesn't have to take on additional work. Matt, since notifications are automated, can you explain the notification sequence?
Yeah, so just to give everybody a kind of an idea here, our predictions, let's say, 30 days in advance of the appointment, they, have around an 80% accuracy rate, which is, really good, really strong, right? But we're not really gonna do anything to the schedule necessarily with that information, right? That information is just being used to update the content in the text, the email, or the phone call that goes out. So let's say 5 to 7 days before the appointment, we send our first reminder, right? The language in there would be different if they were considered high risk. And so they could easily just click and tell us if they're coming in or not. From there, we would follow up again somewhere between 1 to 2 days out, just depending on the timing of everything. And we don't want to send somebody a text message, in the middle of the night or something like that. We want to, be communicating in normal waking hours and give that person a chance to tell us if they're coming or not. And as we sort of advance through the process here, we're looking at that information, right? Did they confirm? Did they cancel? Did they open anything? Did they click anything? Are they doing forms? Are they taking any other action that would help us better understand if they're coming or not? And so as we get into that 7-day window, we're updating and changing the prediction on a daily basis. And so at the end of the day, the patient is really determining the final accuracy here, because all we're doing is just communicating differently and then asking the person to just tell us. So the accuracy can be really high if we get that confirmation or we get that cancellation from the person. We're really accurate, right? That person told us. And that's really the point of this type of technology, is to not just make a prediction, but to reach out automatically. Now, we also have all of our notifications, all of our forms, our whole website, everything that we offer is available in lots of different languages. Some of the most popular languages are other spoken languages within the United States. So we can also communicate in the language that the person understands and speaks, in their first language. And so that's another important factor too, is not having language barriers be part of the process. But this is sort of a typical sequence here for an in-person visit and those notifications. And again, just how the AI and patient engagement ties together.
We've spent the last couple of slides talking about notifications. Can you take the audience through a quick demo so they can see capabilities of our appointment reminders?
Yeah, so we've got text, email, voice, our text messages. We can include the address of the location, the name of the location. They can easily be added to a calendar. They can be used to get directions quickly, which is one of the main reasons why we have a 1 hour notification. We don't want somebody showing up at the wrong location either, creating a no-show. And then we have the ability to provide a link, and that link can do all sorts of things for us. It can allow the person to confirm, cancel, reschedule, do forms. And in the very near future, by the end of this year, we'll have a whole digital check-in process where they can make co-payments and do all sorts of other things. So not only are we reminding them of the appointment, but we can allow them to make changes to the appointment, cancel, reschedule, confirm it, do paperwork, get directions, add it to their calendar. So, all of the sort of modern conveniences that consumers have in other industries, we're bringing that to the appointment reminder experience that is also being driven and tied into the AI algorithms that we built.
Matt, on this slide on the slide where you mentioned that men can integrate to provide the attendance predictor and other solutions we offer, can you explain our capabilities in more detail?
Yeah, so Mend can integrate with all of the sort of top brands, whether it be the electronic medical record, the practice management system. And typically what we would recommend in a scenario where we want to do the attendance predictor, the reminders, and have the ability to make changes to the appointment, is we would recommend a bi-directional demographic and appointment interface, which is pretty standard. And that would allow us to get the information that we need, make the prediction, send the automated notifications out, get the person to tell us if they're coming or not. And then if they tell us they're not coming or they want to make a reschedule or anything like that, then we can communicate that back to the master schedule and keep everything up to date. There are also some scenarios we could look at where we could even pass the prediction itself over to the master schedule so that folks could look and see what the prediction is for that day. Maybe there's an appointment you see that is sitting there that says, this person is highly unlikely to attend. Maybe that's a slot that you want to double book and do that a little bit more intelligently. So that's, a business decision for folks to make, but that information can be shared as well within our portal, or that's information we could potentially pass back so that scheduling folks could use that information and act on it.
Before we move on, we wanted to ask the audience a quick question. The question should be appearing now for everyone. And the question we have for you today is, what is your current no-show rate? I will give everyone about a minute to answer. And once everyone is done, I will share the results with all of you. And then we'll move on to finish today's presentation. I see a few more answers coming in. Okay, so it looks like majority of you say 11 to 15%, and little of you are saying 31+%. And thank you everyone for answering that question. Making a prediction sounds interesting, but some of you in our audience today may still be skeptical. How accurate is the MEND patient attendance predictor?
And so I wanted to just show some of the, look, it's a little technical, but wanted to just show some of the results. And obviously where it says attend 0.86, that's 86% precision or 86% accurate, if you will. And then giving another example for no-show as an outcome, it's 79% accurate. So we're able to predict the possible and potential outcomes of an appointment with solid precision. It's accurate. The predictions themselves are accurate. But what's even more accurate is if we reach out to somebody and they just tell us. And I think this is the biggest, a cancellation is one thing, right? Somebody's called, somebody has said, I'm not coming. And that's great. They've said something. Now there's an opportunity to fill that slot. With a no-show, that's what's so hard about it or maddening about it is they're just not telling us that they're unable to attend. So that's sort of the core problem here. And so really, by introducing some convenience, by removing any friction from the process so they can just tell us they're not going to come, that's the real magic here, right? Not necessarily how accurate can we make a prediction. You could maybe build an algorithm that's 97% accurate, but then what? Then what are people going to do? What about the other 3%? So on and so forth. So would it even be ethical based on the data that you're using? So the real key here is that it is accurate. But what is going to be far more accurate is when we use that data to reach out and just get the person to tell us if they're coming or not.
My understanding is that we make an initial prediction weeks in advance. Then we update the predictions daily once we start sending notifications. What does the final accuracy rates look like after automated outreach to the patient?
Yeah, so there can definitely be some variances in the accuracy rates, but just to kind of recap everything that's going on here, right? We're making an initial prediction. We're then starting to engage with folks, text, email, phone calls. We might be sending digital forms for them to complete. We'll be introducing a digital check-in process. So they could be doing other things. If it's a virtual appointment, they could be testing their connection in advance of the appointment. We're looking at things like opens and clicks and what have you, and all of those things can further bolster the accuracy. But the most accurate piece of data that we can get, just going back to the no-show problem, is just getting more people to tell us, tell us if you're coming in, tell us if you're not able to make it. And by communicating, days in advance, 5 to 7 days, again, 1 to 2 days before the appointment, we're giving somebody those opportunities to tell us if they're coming or not. And that's extremely accurate, right? I mean, there are then going to be the rare cases where somebody says they're coming, and maybe they end up having car trouble on the way and they don't end up making it, right? That's still not going to be 100% accurate, but getting the person to just tell us is going to be far more accurate than doing nothing. And it's going to be far more accurate than just relying on a prediction alone. So that's why that patient engagement piece is just so fundamental to this product and a kind of men's offering as well. So for certain appointments where we make that engagement happen, that prediction can be, as close to 100% accurate as you can get. So again, we just kind of use the initial data to get a sense of if they're coming or not. And then we start calling, emailing, sending texts, and just get the person to tell us.
Mend has a lot of exciting innovations available today and yet to come. Matt, can you take the audience through our patient journey for both in-person and virtual appointments?
Yeah, so Mend is a complete patient engagement platform that was really built from the ground up for the modern practice. And I think the modern practice has a combination of virtual appointments, in-person appointments, maybe phone appointments, secure messaging appointments, all of those touch points with a patient. That is really where Mend can add value. And so if we kind of go through the journey here from patient self-scheduling or getting those scheduled appointments to the appointment reminders and the attendance predictor that complements that, to being able to do things in the visit or during the visit, a check-in process that we're working on, completing forms, we're working on being able to pay before the visit happens, collecting vitals, again, using AI, conducting the video visits themselves, providing a virtual waiting room experience if somebody has to wait before that virtual appointment, to different touch points after the visit, following up with them for surveys or getting feedback or pushing them to reviews, to a really exciting offering that we have is automated patient payments after the visit. Once those outstanding balances have tabulated and cleared, we can send out digital payment forms and collect those patient balances without sending statements and taking 30 days to collect. We can send out texts and email and remove the friction from that process as well. So whether we're talking about before the visit and reducing no-shows to during the visit, or even providing the platform to do a virtual visit or after the visit, following up, getting payments, etc. Mend is really one-stop shopping for an organization to put one experience together, sort of have one partner, one integration that they maintain, and maybe even save some money, get rid of, products that might be expensive if you bought each of these things on their own. Consolidating that into the Mend platform is probably going to save organizations a lot of money as well.
Okay, so Matt, every time I see this demo, it blows me away, and I get very excited about the future of healthcare. Please explain what this is and how it works.
Yeah, so we're going to kind of take everybody quickly through our vision here in a second, but another exciting innovation that we're working on is really automating that whole check-in process, right? To understand if they're coming or not, get the confirm, get the cancel, get the forms, get the payments, and then also capture the vitals. And so a roadmap item, something that folks are likely to see by the end of this year, early next, is the ability with just a camera that's on your smartphone right now, a web camera, if you have that on a laptop or computer, that you're on any camera. This sample that you saw, this demo that I did, I've had this camera for 5 years. It's a 720p, nothing special about it at all. And you can see I was able to capture my heart rate, my breath rate, my blood pressure, my heart rate variability, and there's lots of other potential opportunities here. So Mend is really working towards and building a complete intake experience. We have an amazing telehealth platform, and then also engaging after the visit as well, whether there's a payment that's owed, or we want to get feedback, or communicate about other things.
Incredible content today. Matt, can you summarize Mend's vision for digital health and patient engagement?
Yeah, so just to kind of take everybody through our vision here and a little bit of our roadmap. So definitely available now. Patients are going to be able to schedule their appointment, make changes. We will have appointment reminders driven by AI that we covered today. All the forms will be completed digitally, and we'll move that information back into the medical record automatically. Patients are going to check themselves in automatically. So during that process, we'd be able to collect copays. If it was a virtual visit, we're going to be able to identify who might have trouble connecting in advance of the appointment. We're going to get the vitals through just a basic camera that you saw a quick demonstration of. And if it's a virtual visit, we're going to have a wait room experience that we have that today. We're going to further remove language barriers during virtual visits by having captions, real-time translations between providers and patients. And a little longer term on the roadmap is how do we, integrate and connect technology that will even handle the documentation automatically and remove some of those burdens from providers. Finally, again, after the appointment, collecting any outstanding balances or getting feedback, and really just working towards a vision at Mend where patients and providers are just able to spend time together, right? Where it's not clinicians, 60% burden from documentation, and patients, sort of not having these frictionless experiences. So they're no showing and maybe not attending their appointments. We're going to work towards as a company to remove and eliminate a lot of those barriers so that patients and providers can really just spend time and develop that relationship again.
If you are looking for more informative content, we keep a library in the resource section of the mend.com website. In April, Matt authored a webinar and ebook titled Telehealth and Patient Engagement, a look into the very near future. This content goes into more depth on some of the previous slides showing the patient journey, web camera vitals, and of course, Mend's future vision. Simply navigate to mend.com, click on resources, and you can access all of our on-demand content there. I do want to note that on August 16th, Matt and I will be hosting another live webinar on telehealth connectivity. Simply navigate to mend.com, click on resources there, and that's where you can register for all of our live events in the webinar section. And with that, Matt, let's go ahead and jump into the questions. And as a reminder for our audience, in the Zoom toolbar, there is the Q&A option, which will make easier for us to answer your questions. Okay, question 1. Thomas asks, how is the AI predictor affected if we only collect limited patient demographic data in Mend? I think you're muted.
Oh, sorry. And there we go. So basically, we're taking in just a limited amount of data in a demographic and scheduling interface, right? And there's really only basic demographics. Just to kind of define that a little bit, we really need things like name, date of birth, we collect gender, and then really it comes down to contact information. We might have an address, your email, your phone number. So we're not collecting or looking at things like your, religion or race or what type of insurance you have or anything like that. From there, we break that down into other pieces of data into about 40 or 50 different factors that we use. So we sort of take that information and we generate other factors. So for example, distance could be one, right? What is the person's distance from the location that's assigned to that appointment to their address and their location? So we can sort of create and generate these different factors. And then we can add in data that we're seeing along the way. So any patient engagement data that we have, other actions that they're taking, confirms, cancels, clicks, opens, forms, payments, vitals, testing their internet connection, all of these pieces of information, again, can factor in to finally even what's the history? What, we can maybe look back a year and see what's their cancel rate, what's their no-show rate, what's their attend rate. So we can derive a lot of different information just from the basic demographics and appointments feed that we get from your system to come up with that initial prediction and know who we need to communicate differently with.
Okay, I have another question for you. Francis is asking, what is the response rates from the AI appointment reminders?
Yeah, so I think that's a great question. I don't have the exact numbers off the top of my head, but our engagement rates are very high. So for example, some of the numbers that I do have off the top of my head, digital forms, for example, we see an 86% completion rate. We see almost 70% of those completed within an hour. So a couple things there. So I would imagine that our response rates are really high, mainly being that first we're communicating in an electronic format, in text, in email. Primarily, that's how we're communicating. Text messages, 90% are read within 3 minutes. And then we're also making sure that we hit the inbox. So we're leveraging short codes to send text messages so that we'll hit the inbox. Our email is verified. We're a verified email sender. So our email addresses are sent around to all of the internet service providers and email providers, and we're certified, so they know our content is good, our emails are good, so they'll move them to the inbox. And then we have technical support, instant technical support available too. So if somebody was trying to confirm, cancel, or take an action, and they had any trouble, we could troubleshoot and walk them through that. So I apologize, I don't have the exact data off the top of my head, but that's something we can circle back on. And I would imagine, given some of our engagement rates from our digital forums, that those engagement rates are really high.
We have an anonymous attendee asking, what is the process of taking a healthcare office from paper to cloud-based?
Yeah, I think, we have a full implementation process and team that from the sales process and looking at a demo, working with a solution architect that will lay out a statement of work, and then sort of work with our implementations team to really plan that out. Get any interfaces in place, develop workflows, may even be a phased approach. Maybe you want to start with one thing, telemedicine, and then do forms and or payments. So I would say if you really want to get an in-depth look at that process and maybe take a look at timelines, if you just go to men.com/demo, one of our folks can show you the platform and kind of walk you through what that implementation process would look like. But it's what we do all the time. So it's our specialty and we might be able to help.
Cheryl posted the following question: what is involved to set up the attendance predictor?
Yeah, so to get it set up, we need to have the interface in place, hopefully bi-directional for demographics and appointments. We would have some other workflow design for the appointment reminders, and just a little bit of setup there. From that point, we would take a look at the data. We would run some data, look at the accuracy, and then we have some tweaks that we can make, whether we want to be a little more conservative or a little bit more aggressive. And from there, it's testing with an implementation specialist, maybe even a soft go live, and then rolling it out to the rest of the organization. So we have solution architects, implementation specialists, and success managers that will guide through every step in the process.
Charles is asking, does previous no-show history affect the AI?
So yes, the history does affect the accuracy. That can be a really good indicator. It's not, I think one of the ways to think about this is for somebody to really be considered high risk, there's typically going to be a number of things that are going on, right? It probably wouldn't just come down to one factor, like, their past attendance rate. It might be that, and the fact that this is a follow-up visit, and maybe the follow-up visit appointment types have a pretty high no-show rate. And then maybe they're pretty far from the appointment as well. So there's typically going to be a few things going on, but that is an important data set to have, and something that we would work to bring in, sort of loading in that historical data so that the machine learning algorithms could use that for your predictions. Definitely going to increase the accuracy of the initial prediction day one, if we have access to that data.
David is asking if MEND can still work with EMR systems if it's not on the list of systems we work with.
Yeah, David, great question. Yes, we have an integrator that has a lot of flexibility to connect different systems. They can really plumb anything and can really just conform to the standard of that system. So that could maybe be a flat file, it could be an API, HL7, but yes, and we might project a slightly longer implementation timeframe, but we do work with some integrators that just have some amazing capabilities to kind of connect or plumb any system. So I would say as long as that electronic medical record system has some ability to play with others, then there's going to be an extremely strong probability that we would be able to integrate it for you.
All right, thank you, Matt, for those great answers. I think that will be concluding our Q&A session for today. I wanted to thank you everyone again for tuning in and joining Matt McBride and myself today. It was a pleasure discussing this with you, Matt, and we hope you all tune in again next time.
Thanks, everybody. Have a great day.